In America, a single hospital stay can bankrupt you. In Norway, the maximum you'll ever pay for healthcare in a year is $280. Let me say that again, $280. Total. For everything. If you've ever skipped a doctor's appointment because you couldn't afford it, what I'm about to show you will make your blood boil. Because while Americans are choosing between rent and insulin, Norwegians are walking into hospitals with nothing but their health card and walking out with zero bills. But wait. Before I show you exactly how Norway's system works and what you can do to protect yourself right now, hit that subscribe button. Because I'm exposing broken systems like this every single week. The healthcare secrets they don't want you to know, the financial traps designed to keep you struggling, and the real solutions that actually work. Comment I subscribe below, and I'll personally welcome you to a community that's done playing by rigged rules. With that said, let's dive into the numbers that'll change how you see American healthcare forever. Meet Sarah Thompson from Dayton, Ohio. 54 years old, insurance agent, mother of two. She started having chest pains in February. Tightness that wouldn't go away. Shortness of breath climbing stairs. Did she go to the hospital? No. Why? Because her health insurance deductible was $6,000. $6,000 she didn't have. So she waited. Took some Advil. Told herself it was just stress. 3 months later, Sarah collapsed at her desk. Her coworkers called 911. The ambulance ride alone cost $2,400. The 2-day hospital stay for her heart attack? $47,000. She survived. But 6 months later, she lost her house. This isn't a rare story. A 2023 Harvard University study found that 530,000 American families file for bankruptcy due to medical bills every single year. That's one family every 60 seconds. Let that sink in. Now let me show you what happened when Bjorn Hansen in Oslo, Norway, had the exact same symptoms. Bjorn felt that same chest tightness, same shortness of breath. But Bjorn called an ambulance immediately. Because he knew something Sarah didn't. The ambulance would cost him nothing. 0 kroner. The hospital stay? Also 0. The medication he'd need for the rest of his life? $28. For the entire year's supply. Here's how Norway's system actually works, and why it's blowing American minds right now. Every Norwegian has a fee cap. Once you've paid 2,900 kroner, that's about $280 in annual medical expenses. Everything else is free. Everything. Doctor visits, specialist appointments, hospital stays, surgeries, cancer treatments, physical therapy. All of it covered. Americans spend an average of $12,555 per person on healthcare every year. Norwegians spend $7,065. And here's the kicker. Norwegians live an average of 3 years longer than Americans. According to the 2024 OECD Health Statistics Report, Norway ranks second globally in healthcare outcomes. Quality of care, life expectancy, infant mortality rates, top tier across the board. America? We rank 37th. 37th. Right between Costa Rica and Cuba. But I know what you're thinking. Sure, but Norwegians pay crazy high taxes, right? There's no free lunch. You're absolutely correct. And here's where it gets interesting and controversial. Yes, Norwegians pay higher income taxes than Americans. The average tax rate in Norway is about 38%. In America, it's around 24%. That's a 14-point difference. Sounds massive, right? But nobody ever shows you the full math. So let's do it right now. Meet Emma Larson. She's a high school teacher in Bergen, Norway. She makes 675,000 kroner a year, about $65,000 in US dollars. After taxes, she takes home roughly $40,300. She pays her $280 healthcare cap by March, and that's it. Her net spending money after healthcare? $40,020. Now meet Jessica Martinez, high school teacher in Phoenix, Arizona. She also makes $65,000. After federal, state, and payroll taxes, she takes home about $49,400. Sounds better than Emma, right? Wrong. Jessica's health insurance premium through her school? $4,200 per year. Her deductible? $3,000. Her copays and medications for the year? Another $1,000. Total healthcare costs? $8,200. Jessica's actual spending money after healthcare? $37,800. Emma, the Norwegian teacher with high taxes, has $2,220 more in her pocket than Jessica, while getting objectively better healthcare, while never worrying about medical bankruptcy, while going to the doctor the moment she feels sick instead of waiting and hoping it goes away. That pattern repeats across almost every income level. The tax burden argument falls apart when you actually run the numbers. But it gets even better, or worse, depending on where you live. It's not just about the money. It's about something the healthcare industry never talks about: freedom. A 2023 University of Bergen study surveyed 5,000 Norwegians and 5,000 Americans about healthcare-related stress. 87% of Norwegians reported zero anxiety about their ability to afford medical care. In America, 64% said they experience regular stress about medical bills. Regular stress. The kind that keeps you up at night. The kind that raises your cortisol, damages your heart, shortens your life. Let me tell you about Lars Johansson, 62-year-old electrical engineer in Trondheim. Last year, he found blood in his urine. Terrifying, right? He called his doctor that morning. Got an appointment the same afternoon. Doctor ordered an MRI. Lars had the MRI 5 days later. Results showed a suspicious mass. Surgery was scheduled 2 weeks after that. Total cost to Lars? Zero. Not zero because insurance covered it. Zero because there was nothing to cover beyond his annual $280 cap, which he'd already hit. He kept his job throughout treatment. No financial stress. No GoFundMe campaigns. No choosing between his mortgage and his life. He focused entirely on recovery. And today he's cancer-free. Compare that to Tom Richardson, 61-year-old electrical engineer in Denver, Colorado. Same symptoms. Same terrifying discovery. Tom's insurance required pre-authorization for the MRI. That took 3 weeks. The MRI itself was scheduled 4 weeks out because the imaging center was backlogged. Results came back showing the same suspicious mass Lars had. Surgery? Tom's insurance had an $18,000 out-of-pocket maximum. He didn't have $18,000. He took out a loan. The surgery itself was delayed 2 more months while he arranged financing and got secondary insurance approval. 2 months. With cancer. Because of paperwork and money. Tom's cancer-free now too. But he burned through his retirement savings, took on debt, and his cortisol levels during those months of delay? Through the roof. A 2022 study in the American Journal of Public Health found that stress from medical debt increases your risk of heart attack by 44%. The system designed to save your life is literally killing you with stress. Visual. Stress hormone chart comparing Norwegian versus American patients. And here's the statistic that should enrage you. That same 2022 study found that Americans delay necessary medical care 41% of the time due to cost concerns. 41%. Almost half of us are walking around with untreated conditions because we're terrified of the bill. In Norway, 3% delay care. 3. So here's the obvious question, right? If Norway's system works this well, saves money, produces better outcomes, and reduces stress, why doesn't America just copy it? The answer is darker than you think. In 2023, the U.S. healthcare industry spent $699 million lobbying Congress. That's $1.3 million per member of Congress. Not to improve your care. Not to lower your costs. To maintain the current system exactly as it is. Follow the money. Insurance companies made $41 billion in profit last year. Pharmaceutical companies? Over $80 billion. Hospital corporations? Billions more. The current chaos isn't a bug, it's a feature. It's working exactly as designed. Just not for you. Want a visual? The CEO of United Healthcare made $142 million in 2023. $142 million. Norway's entire Minister of Health and Care Services? Their salary is $185,000. Let me introduce you to Jennifer Cole. She's a former insurance adjuster who worked for a major carrier I legally can't name. She left the industry last year and started speaking out. Jennifer was trained, explicitly trained, to find reasons to deny claims. She had rejection quotas. If she approved too many claims, she got written up. One day, she was assigned to review a stage 4 pancreatic cancer patient's claim for a specific chemotherapy drug. The drug was recommended by 3 oncologists. It was the patient's last hope. Jennifer's supervisor told her to deny it because a comparable drug existed, a drug that had already failed for this patient. She denied the claim. The patient died 6 weeks later. That was Jennifer's last day in the industry. She now advocates for healthcare reform and says this: the system doesn't deny you care by accident. It denies you care on purpose, then bets you won't have the time, money, or energy to fight back. And most people don't. But here's what gives me hope. You can't change the system overnight. That takes years of political pressure and voting. But you can protect yourself right now. There are alternatives the healthcare industry desperately doesn't want you to know about. First, HealthShare Ministries. These are legal non-insurance programs where communities pool money to pay each other's medical bills. Monthly costs range from $200 to $400. They're not perfect, they don't cover everything, but for catastrophic coverage, they work. And they're real. Over 1 million Americans use them. Second, direct primary care, or DPC. You pay your doctor directly, usually $75 to $150 per month, for unlimited access. No insurance middleman. No claim denials. You call, you get seen. Many DPC doctors even do house calls. A 2024 Stanford medicine study found that DPC patients have 35% fewer emergency room visits because they actually get preventive care instead of avoiding the doctor until things get desperate. Third, medical tourism. For major procedures like hip replacements, heart surgeries, or dental work, you can fly to accredited hospitals in countries like Mexico, Costa Rica, or Thailand and save 40% to 80% of U.S. costs, even including airfare and hotels. The quality? Often identical or better. Many of these surgeons trained in America. Fourth, GoodRx and similar prescription apps. They're free. You pull up your medication, compare pharmacy prices, and use their coupon. Average savings? 70% off retail. It's insane that this is necessary, but it works. Let me tell you about Marcus Washington. 47 years old, lives in Austin, Texas. 2 years ago, he was paying $6,000 a year for insurance with a $5,000 deductible. So basically, he was paying $11,000 before his insurance did anything. He switched to a DPC membership at $125 a month and a HealthShare for catastrophic coverage at $250 a month. Total annual cost? $4,500. He saves $4,800 every year. And here's the thing. He actually goes to the doctor now. Regular checkups, preventive care, caught high blood pressure early before it became a crisis. Under his old insurance, he avoided the doctor because even with insurance, copays added up. This is what healthcare should feel like. Accessible, simple, focused on keeping you healthy, not extracting maximum profit. But the real question is this. If you could choose right now, pay a maximum of $280 per year with zero stress, zero bankruptcies, zero claim denials, zero fear of getting sick, or keep your current system where a single ambulance ride can cost more than a used car and a hospital stay can obliterate your life savings. Which would you pick? I already know your answer. The question is, does your government? Drop a Norway in the comments if you'd move to Norway tomorrow for their healthcare system. Or drop a United States if you think America's system can actually be fixed. Let's see which one gets more. I'm genuinely curious what you think. And if you know someone, a parent, a friend, a coworker, who's drowning in medical bills or avoiding the doctor because they can't afford it, send them this video. Share it. It might literally save their financial life. Because here's the truth they don't teach you in school. In Norway, they believe healthcare is a human right. Something you deserve simply because you exist. In America, It's a privilege you pay for. And if you can't pay, well, you know the rest of that story. You've probably lived it. The system won't change until we demand it. But until then, protect yourself. Educate yourself. And whatever you do, don't let them convince you this is normal. It's not. 50 other developed countries figured this out decades ago. We're just the only ones still pretending medical bankruptcy is the price of freedom.